Are kidney ultrasound false positives a common problem? Imagine going for a kidney ultrasound and hearing there might be a problem, only to find out later it was a false alarm. That's what we call a false positive, and it's an important part of understanding how kidney ultrasound works. A false positive happens when an ultrasound suggests there's an issue like a stone or a tumor, but further tests show everything is actually normal. Kidney ultrasounds are very common in diagnosing and screening for kidney problems and kidney cancer because they are safe, non-invasive, and don't use radiation. They're great for spotting structural issues like kidney stones, cysts, tumors, or blockages. But, like all medical tests, they aren't perfect and can sometimes give misleading results. For example, when looking for kidney stones, ultrasound uses a special feature called the twinkle artifact. This appears as a color signal that can mimic a stone. However, studies show that relying only on this artifact can lead to a high false positive rate, sometimes as high as 51%. That means about half of the positive findings might not be real stones. The accuracy of ultrasound in detecting stones depends on the experience of the technician and the quality of the equipment. When it comes to swelling of the kidney caused by urine backup, known as hydronephrosis, ultrasound is more reliable. Its ability to correctly identify those without the condition, called specificity, ranges from about 59 to 83%. Still, false positives can happen, especially if other factors mimic the signs of swelling. Ultrasound also plays a role in detecting kidney tumors, but it can't always tell if a mass is benign or cancerous. Some benign conditions, like complex cysts or infections, can look similar to tumors on ultrasound. This can lead to false alarms, where further testing like a CT scan, MRI, or biopsy is needed to confirm whether it's cancer or not. In prenatal ultrasounds, false positives are also a concern. Sometimes, early screenings suggest abnormalities that turn out to be normal after more detailed testing. This can cause unnecessary worry for expecting parents and lead to extra procedures. So, are false positives common? It depends on what the ultrasound is checking for. For kidney stones, false positives can be quite frequent, especially if the ultrasound relies solely on the twinkle artifact without considering other signs or clinical information. For swelling of the kidney, false positives are less frequent but still possible. When it comes to tumors, ultrasound can raise suspicion but often cannot give a definitive answer, so additional tests are usually needed. Remember, ultrasound is a valuable first step in kidney health and cancer screening, but it's not the final word. Positive findings should always be confirmed with more detailed imaging or tests. This approach helps prevent unnecessary anxiety and ensures accurate diagnosis. In summary, false positives do happen with kidney ultrasound, and their likelihood varies depending on what's being examined and how the test is performed. They are a known limitation but not a reason to avoid ultrasound altogether. Instead, they highlight the importance of following up with further testing and consulting healthcare professionals for personalized advice. Always seek guidance from your doctor to interpret results properly and determine the best next steps for your kidney health. This balanced, careful approach supports accurate diagnosis and effective care, aligned with current medical guidelines and best practices.